For more than 60 years, Janssen has been committed to minimizing the burden of disease for people living with mental health disorders such as schizophrenia. While many disease areas have experienced rapid innovation in recent years, schizophrenia has generally not seen the same focus and attention. Through our Medicines Development Program, we aim to change this. The Trevicta plan is the latest example of this. Representing Zeplion, once-monthly paliperidone palmitate, and Trevicta, 4 per year paliperidone palmitate. With the unique 4 per year dosing of Trevicta, Janssen is realizing its ongoing commitment to giving patients with schizophrenia freedom from the frequent administration of daily oral antipsychotics and helping them to live the lives that matter to them. But how can Trevicta deliver this unique 4 per year dosing? Let's take a closer look at its administration and pharmacokinetic characteristics. Following 15 seconds of vigorous shaking to ensure a homogeneous suspension, select and attach the correct needle. Trevicta is injected slowly into either a deltoid or gluteal muscle, using only the thin-walled needles provided. For guidance on needle selection with Trevicta, see the summary of product characteristics. Trevicta must be injected within 5 minutes after shaking to avoid sedimentation of the suspension prior to administration. Trevicta is composed of insoluble microparticles, each of which are composed of thousands of molecules of paliperidone palmitate. These microparticles are slowly broken down over time, gradually releasing molecules of paliperidone palmitate into the muscle, enabling the 4 per year dosing of Trevicta. Esterase enzymes present in muscle tissue metabolize these paliperidone palmitate molecules, cleaving the palmitate from the molecule and resulting in the creation of palmitic acid and the active paliperidone. The palmitic acid is naturally reabsorbed as a long fatty acid by muscle and other tissues, and the active paliperidone enters the circulation. This molecular structure, combined with an increased particle size and concentration of paliperidone palmitate compared with Zeplion, results in prolonged release and absorption characteristics, which facilitate the unique 4 per year dosing of Trevicta. In preclinical studies, paliperidone plasma concentrations gradually rise following a single intramuscular dose of Zeplion, reaching peak levels after a median of 13 days, with a median apparent half-life of 25 to 49 days driving its subsequent elimination from the body. In preclinical studies with Trevicta, peak plasma concentrations gradually rise with a single intramuscular administration until they reach a peak level after a median of 30 to 33 days, with a median apparent half-life of 84 to 95 days following deltoid injections and 118 to 139 days following gluteal injections. As such, when administered in 3 monthly intervals and at doses that are 3.5-fold higher than the corresponding dose of Zeplion, Trevicta results in similar paliperidone exposure, efficacy and safety to that reported with corresponding monthly doses of Zeplion. Paliperidone passes through the blood-brain barrier and travels through the cerebrospinal fluid to specific receptors on a patient's neurons. At the neuron, paliperidone binds strongly to serotonergic 5-HT2 receptors, altering the availability of serotonin within synapses, and also antagonizes dopaminergic D2 receptors, altering the availability of dopamine within synapses, and manipulating the mesolimbic, mesocortical, nigrostriatal, and tuberoinfundibular pathways associated with the pathophysiology of schizophrenia. In fact, these D2 and 5-HT2 receptors are believed to be involved in the manifestation of positive and negative symptoms of schizophrenia. With 2 formulations allowing sustained release of paliperidone, the Trevicta plan offers a convenient treatment solution for both you and your patients. What's more, with the Trevicta plan, you can support your patients throughout their schizophrenia journey with the consistency and convenience of established and related formulations, guiding them from once monthly Zepleon towards the freedom of the only 4-per-year treatment, Trevicta. To learn more about the benefits of Trevicta and the Trevicta plan, visit www.janssenmedicalcloud.net.